and would like to welcome everybody this morning on probably our last meeting of the year. So welcome to our board members and to our audience for being here today, and for, of course, staff for preparing us today. And I'm going to ask for the roll call.
Good morning, everybody. Thank you for coming, first of all. I'm just going to quickly go down the list. If you're here, just say here. Thank you. Roman Ruiz for Lieutenant William Hutchinson. Amber Smalley for Supervisor Spiegel.
Here.
Thank you. Dr. Ben Howdigi.
Here.
Dr. Matthew Chang.
Here.
Daryl Fry.
Here.
Dr. Kendrick Davis. Bill Blankenship. Chair Leticia de Lara.
Present.
Dr. Charles Lee Johnson. Angelina Coe.
Present.
Linda Barak. Carol Alba.
Here.
Anise Smith.
Here.
Savannah Brown for Danielle Johnson.
Present.
And Karen Spiegel.
Honored and blessed to be here.
Thank you. And we have established quorum.
Thank you so much. Okay, next we will move on to consent items 2.0, which include the minutes of October 3rd, the proposed 2025 meeting calendar. Is there a motion to approve the two items?
So moved.
Is there a second? Second. Is there any discussion? There being no discussion, all those in favor say aye.
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 Aye. We're okay with doing verbal ayes today since we don't have anybody on Zoom, correct? Okay, thank you. Okay, so we'll move on to the next item, 3.0, public comment. Is there any member of the public that would like to address the board this morning on an item not listed on the agenda? You are invited to step forward. Oh, I thought I included that in the consent item. I said the two items. Is that okay? Okay, very good. So 3.0, any members of the public that would like to speak on an item not listed on the agenda? How about on Zoom? Is there anybody that would like to speak? No? Okay, there being none, here, please forward, step forward. Thank you.
You said STEP. My name is Kim Williams. I am the Director of Housing for Step Up on Second. And I just want to come and I just want to say that I've been the director. I was promoted in October of last year. And ever since then, when I've been overseeing our Riverside County grants, that anytime I talk to anybody within the county, outreach, any agencies, that I hear how amazing and our team's doing, the collaboration between all the agencies, and it just warms my heart. Today, this morning, 4 different people came up and told me about the communication and collaboration with everybody as a whole. So I just want to thank all the agencies and for our own outreach teams for the amazing work that everybody's doing. And thank you.
Thank you so much. Appreciate you being here. Is there any other member of the public that would like to address the board? Zero old business. The first item on old business is 4.1, Youth Homelessness Demonstration Project subrecipient update. I will turn over to Amy Primrose Puente.
Good morning, Board of Governance members. Well, I have some exciting news to share with you all. At the last Board of Governance meeting on October 3rd, an updated budget was presented and approved for a Youth Homelessness Demonstration Program grant, YHDP. During that meeting, there was a lot of discussion about our joint project for Moreno Valley College and hopefully partnering with Path of Life. We're happy to report that as of October 31st, 2024, all subrecipients, including Moreno Valley College, have confirmed that they are, willing to carry out the project. The partnership between Moreno Valley College and Path of Life has also been confirmed. So we are starting this November and December, we will begin executing contracts. All agreements with HUD have been executed. With the exception of our supportive services projects, they have not yet been approved, but more to come on that. So really exciting news. Our Moreno Valley project is going to be rolling out by March 1st and partnering with Path of Life. And all projects should be stood up by April 1st, 2024. And that's it. Thank you.
Thank you, Amy. Is there any questions? Are there any questions from the board?
Yes.
Yes, Karen.
Sorry, I was just.
Nice job, Amy, and to the whole team. I know this has been a lot of work in process. I wanted to ask, this is a demonstration program. So it seems HUD will be analyzing the outcomes of how this infusion of money across the United States works. Do we have any idea? Because a lot of times demonstration programs often will become permanent programs. Have you heard about anything like that in terms of discussions with HUD or where we are in the scheme of things allocating more funds to the, I know we're just getting started. I'm just curious because demonstration is a great opportunity to then become permanent programs.
That's a great question, Karen. The impression that we're getting from HUD is that this will be permanent funding. However, only successful projects, right? They're very, as I've shared before, they're very prescriptive. So projects that aren't showing positive outcomes, they absolutely won't, refund. But the impression that we're getting is that it will be permanent, yes.
And can you remind me, was this a formula allocation based on our demographics for YHDP? Do you remember?
I'm gonna have to get back to you on that, Karen, because I'm not 100% sure how the allocations were
Okay.
distributed.
Keep up the great work. You guys are
Thank you.
amazing.
Thank you, guys.
And to all the providers too.
Thank you.
Any other questions or comments from our board members?
Just a
Yes.
comment. I mean, kudos to you, Amy, and the team. I know it's a lot of work to put it together, but even to Karen's point, how powerful is this program could be permanent, not only demonstration, but a real active thing moving forward. So just kudos to you. And we also need to see this program successful for that to be so. So congratulations.
Thank you.
I knew you wanted to say something. Any other board members have any questions or comments? How about any member of the public? Would anybody like to say something? Okay, very good. Thank you very much, Amy. Great job. We will move on to, and just one thing is that I'm actually going to allow the public to speak on informational items now because of recommendation that we do that. So not just action items, just information as well. Okay, so next we will have 5.0 new business, 5.1 HHAP, funding recommendations for the Pathways to Home project. And Amy, again, no? Tanya.
We agreed to switch. So good morning, board, chair, vice chair. My name is Tanya Torno, and I am the deputy director with Riverside County's Housing and Workforce Solutions Department. And with you and the rest of our COC membership body who is in attendance, not only in person today, but I know in large part virtually, we have the responsibility of coordinating, managing, and facilitating homeless dollars that come to the continuum of care. And today, the item before you is to review funding recommendations for the Homeless Housing Assistance Program, Round 4 allocation that came to the continuum of care. We want to note that while we are now on our 4th round of HAP, and that means we've not only gone through this 4 times, we've had 4 RFPs, and we've come to the board to review funding recommendations, and that we really took the community's feedback as well as the provider's feedback in considering how to allocate this funding. And so while previously we looked at funding individual projects, and through language in the contracts, we strongly encourage subrecipients to work together, to take referrals through the coordinated entry system. We really learned through those 3 previous rounds areas where we could strengthen our approach this time. And that included looking at this round 4 as really a form of a demonstration project where, of course, we would fund individual projects in 4 distinct categories, which include street outreach, emergency shelter, rapid rehousing, and diversion, with a goal that these teams would all work together to house 100 individuals, so that a person that is identified in the street by any of our street outreach teams has the ability to facilitate a bed reservation at a shelter that has agreed to function as low barrier and basically eliminate as much eligibility criteria as part of their pre-screening process to take that person directly from the streets into their bed. And once that person is placed in the shelter, the goal is for those case management services, as they do now, to continue, but with the knowledge or with the additional tool that those same individuals would then be connected to a housing assistance provider that through HAP would provide what we call rapid rehousing, facilitate or provide security deposit assistance and rental assistance for a period anywhere of 12 to 24 months. I really wanted to stress that part of our challenge, as always, is the limited number of resources. And I know that I am speaking to experts in the room who understand this at large, because we're all following very closely what's happening at a federal and state level, but we're also very attentive to hearing from our partners on the ground who will tell you that the need in front of their doors, the number of calls that they are receiving far exceeds what they are able to do. So with that in mind, of the approximately $4 million that were made available through this RFP, we received $24 million in asks. So we are being asked to do a lot, which I want to acknowledge every single person, every single grant writer, every single agency that took their time to meet with us prior to the release of this RFP to provide us with their feedback, and who worked diligently to prepare a proposal, because we know that each proposal speaks to the actual need. We know that why, because we often talk about our point in time count numbers and how 3,700 people are identified in one single night, but when we look at our actual system of care and how many people are touching all of our different programs, that number is 5 to 6 times larger at 18,000. So with that, we included a summary of the funding recommendations on the agenda. They are available on screen, and I just want to stress how, to the extent that we are thankful that we have these resources, we recognize the need to do more. And I want you to know that we were very intentional about making sure that we leverage all other resources that are out there. So to that extent, we are looking at, as an example, the RUHS behavioral mobile crisis teams that are out there and are working closely with our existing street outreach teams to coordinate services. We are leveraging resources that have come through us, such as the Encampment Resolution Funding Program that have funded the Santa Ana Riverbed and the San Jacinto Riverbed, and now the Marietta Creek Trail, as well as home key projects that are spread well throughout the county, in addition to the CalWorks Housing Support Program, which prioritizes families with children and can serve up to 3,700 households a year. So I can go on and on, but I want you to know that we really were thoughtful in our approach, and the plan before you looks at how we can best implement the program that we described across the 5 districts and work collaboratively with those projects that I identified, in addition to many of the city-funded street outreach teams across all 5 districts. So with that, I will go ahead and pause and see if anybody has any questions or comments.
Thank you, Tanya. Okay, so I'm going to ask the board for questions and comments, starting with Karen.
So thanks to the team. These funding allocations are always difficult because, Tanya, as you so eloquently said, there's such a huge need compared to the available resources. But I think a couple of things to keep in perspective is we made a promise when we developed the Homeless Action Plan that we were going to use data to make real decisions to fill gaps. And in that Homeless Action Plan, we also talked about doing everything that we could to incentivize cities to really step up to the plate, be partners. I think what you talked about, all of the different outreach teams that are funded, I know in our district alone, just to give an example, for Corona, we've got CityNet, our HOPE team, Mobile Crisis Management, and CBAT, which is a highly, functioning multidisciplinary team. So if there are already resources that are a partnership with cities and behavioral health, there's no need to allocate resources. We need to stretch the funds to fill the gaps where they need to be filled. And I know that these are always very difficult decisions, but I love to see how you guys keep focusing on data, allocating to meet needs, and to show us where there are districts that have a higher need. And we know that it's a process that is subject to change, right? Because need changes, programs change. So I just want to thank you guys because, we go back to what does our Homeless Action Plan say? What does the data say? Thank you.
Thank you, Karen. Dr. Chang.
Thank you, Madam Chair. So Tanya, just so I understand, and I think this is what you're saying. So I appreciate, and I apologize that this was discussed previously, but I appreciate the PIT distribution by district at the bottom of the piece. I'm not doing the math, but it looks as if the funding allocation generally tracks with the PIT counts. Is that appropriate?
Yes, that's correct.
And so also what I heard is that you considered sort of understanding that by my math, you could only fund about 17% of the asks that came in. You looked at sort of the ecosystem as a whole of services available in the area based on existing teams, and they could be city teams, county teams, other teams, and took that into account, also took into account the need by district as evidenced by the PIT count, and tried to layer these services on top of them when you decide how to allocate funds. Is that right?
Correct. You said it better than I did.
No, but I appreciate, and I do understand the resource challenges and how when you can only fund about 17% of asks, how challenging that is. And I appreciate the efforts that those decisions are not made in a vacuum, but are taking into account the other services that are already out there, the other types of services that are out there to try and build the most comprehensive approach you guys can. So thank you.
Thank you, Dr. Chang. Angelina.
Hi, thank you so much, Madam Chair. So you said there was 39 proposals received, so about 11 are being recommended. Is that accurate? 10 or 11 thereabouts?
Yeah.
Okay, so my question, I guess,
13.
I don't know if it's even a question. My comment is, since there were so many proposals received, I know one of the things we've talked about a lot is the technical assistance for future proposals and diversifying the individuals that get funded, so it's not the same old, always carrying the burden, the 20/80 rule kind of thing. So is there any technical assistance that's going to be planned in the future for those agencies that submitted proposals that didn't meet threshold to maybe help them do better proposals in the future or coordinate collaboration efforts with them? I mean, I know it's a loaded question and I know the answer is probably going to be yes, but how can we as board members and as other people part of the COC help with that education and that collaborative effort, especially those of us that do have grant writing experience and have been doing this for a really long time, to kind of provide that mentorship and that assist Not that I'm volunteering my time, but yes, I am, I can assist as much as possible. That technical assistance shouldn't just fall on you and your staff, but also on the COC. So I guess it's not really a question, more of a comment. So thank you.
Thank you, Angelina. Any other board members have any questions or comments? Okay, public, is there any member of the public that would like to address the board on this item? Okay, so I do have a question. I'm familiar with most of all of these, but the one that I'm not familiar with at all, and I'm curious about, is Equitable Social Solutions. Where are they from? And what caught my attention was that they are, first of all, that I didn't recognize their name, also that they're able to serve all 5 districts. What is their capacity?
Yep. So Equitable Social Solutions has received funding from the Continuum of Care in the past. This is actually their second time, but they are fairly new in the homeless sector. But you should know that in addition to providing housing assistance in a previous HAP round, which they've done fairly well, and have done that by specializing in youth services. They have also served as a partner with our workforce services division in managing the youth opportunity centers. And so as we've talked a lot about serving youth and the best way to serve youth and take advantage of existing access points that exist, we've recognized that the youth opportunity centers, which are managed both by Equus, and then there's another partner, CFLC, the California Family Life Center. Hopefully I said that right. I'm seeing some nods, so that's good. They have centers, or Equus has a center in Indio, and they have a center in Moreno Valley. And at these centers, youth can come in to receive career support services and stipends and career coaching, in addition to support in education, pursuing higher education, or even finishing, their current high school education or getting a GRE. And so as part of our youth planning process, we recognize that they serve as a central access point for youth. And so providing them with the housing assistance dollars has been a good resource, and so this would extend that. Even though they have the 2 centers, they have agreed to use this pot of funding, which is diversion funding, to support inquiries that would come through our coordinated entry system hotline for all 5 districts, and support individuals who are homeless, are experiencing a crisis, but really just need a light touch to resolve their homelessness. That could be a bus ticket home. That could be just helping them with their security deposit. That could be helping them mitigate current issues that prevent them from returning to home. But if we can connect with the family members or their friends or whoever their previous roommates are, kind of resolve whatever was going on. So yes, this would be expanding them, and going on to Angelina's point about how we're providing technical assistance and how that has really changed and really amped up as a result of the feedback that we have received from all of you, is that we coordinate monthly calls with all of our subrecipients, and oftentimes meet with them much more frequently than that. But as part of those calls, we would not only be monitoring expenditure of funds, but ensuring that they're meeting performance metrics, serving the number of clients that are outlined in their contract, entering data in HMIS. And then just to take advantage of this talking point, what I would say is that yes, we had to limit who we funded for all the reasons, but everyone who submitted an application and is not being recommended for funding is going to remain on a priority list for us. So as we continue these technical assistance calls, if anyone falls short anywhere, we're going to take the team approach, and we would not have to go back out to bid to solicit new applications. We would lean on existing proposals to come in and supplement any gaps. I just wanted to make sure that that was clear.
Okay. Any, Karen, you have follow-up?
Yeah, and I just wanted to make one more comment about that regarding the types of services you mentioned that are across the districts. You and I have had this conversation, and I think those meetings and coordinated entry will help. I'll use an example. In our city, we had sufficient city resources for rapid rehousing and rental assistance. And I wanted to make sure that some of the funds that were allocated in the second district region, we could focus on the unincorporated areas and other cities that didn't have resources. Because sometimes what people will do is make a referral to coordinated entry. And so more collaboration, you can leverage the city resources to free up for the unincorporated areas and the cities that don't have those resources. So I think there's a way for us to maximize that. Does that make sense, Tanya? Yeah.
Thank you, Karen. Any other board member have any questions or comments? Oh, Ben?
Just a comment, I'm in thinking about these organizations who are ready and willing to provide services. There's just a lack of funding. Something that came to mind, I was in a statewide conference call regarding enhanced case management. That's a Medi-Cal Department of Healthcare Services new service that is funded. And one of their populations of focus is folks who are experiencing homelessness or at risk of. And so I encourage all vendors, providers to look into funding through enhanced case management, also community support services. There's a lot of potential clients out there in the Inland Empire, so encourage those to seek out that funding because it really has helped a lot of organizations that are already providing enhanced case management or community support services. There's also technical assistance funding for that program. I believe it's called PATH, P-A-T-H. So if you just search Department of Healthcare Services, Enhanced Case Management, and or PATH, you'll find resources for that.
Thank you, Ben. Carol?
I wanted to add to Ben's comment. Thank you for bringing that to everybody's attention. I also wanted to add that under both IEHP and Molina, there is an initiative to bring community health workers into your organization. And through that effort, there is reimbursement and funding that can go along with it. So I just think it is something everybody needs to get involved in. And there's lots of training out there for community health workers. Some of it's online, some of it's in person. But I know as a smaller organization, we've been looking at that. And I think it's going to be a great way to move forward. Thank you.
Thank you. Thank you, Carol. Is there any other board member that would like to ask a question or comment? Yes. Elise?
Thank you. Thank you, Madam Chair. And thank you, Tanya. My question is, or which of these organizations, it's the first time that they're receiving funding or the first time that they're receiving HAP funding specifically?
So everyone listed here has received funding before. There are I'm trying to look at quickly. So Equitable Social Solutions and Faith in Action, and Starting Over, this would be their second time that they are receiving funding from the Continuum of Care.
And just a follow up, because I think it was, we discussed it a little bit at our last meeting, but the applications are scored higher when there's an indication of partnering with other organizations, smaller organizations, maybe to give others who in the future would want to apply for the funding the opportunity to partner with an organization that has more experience with working under the grant. And so that was the case here too, that these organizations were scored higher because of their partnerships, existing or planned future partnerships with other orgs.
Yes, that's correct.
Thank you.
Thank you very much. Any other board member have any questions or comments? My last comment before I ask for a motion is the organizations that were not approved, they do have an opportunity to contact you and to ask you how could they do better, right?
Yes, and they have been, which we appreciate. And so we're going to be scheduling individual meetings with them to debrief their scores and provide them with feedback and technical assistance.
Very good. Thank you. If there are no other questions, and I will ask for a motion, the recommended motion, if you would consider that.
So moved.
Okay. We have a first and a second. The recommended motion is to approve the funding recommendations. All those in favor say aye. Aye. Is there any noes? Is there any abstentions? There being none, it is approved unanimously. The next item is 5.2, and this is HUD COC builds, and I will turn it over to Emma.
Thank you, Madam Chair. Good morning, Emma Perez-Singh with the Continuum of Care. On September 16th, HWS released an RFP soliciting applications for the new HUD COC builds application. This is new funding that HUD made available under the traditional COC program. This funding is specific to support the creation of new permanent supportive housing units and is really meant for capital, to provide additional capital to projects that are currently under construction. There were some concessions within the notice of funding application to consider projects that were not in construction but in earlier phases of development. However, looking at the scoring rubric and in order to make our community as competitive as possible, really it lended itself to projects that were currently under construction. So in reviewing applications, we looked at those that were in the later phases of development and looked at projects that already had secured additional funding or were leveraging funding, projects that had secured tax credits and project-based vouchers, PBVs, because these projects are more likely to warrant a higher score for our continuum of care. So this funding is highly competitive. It is a competition nationwide amongst all other COCs. There will be about 14 awards made across the nation. And so we wanted to present the projects that were most competitive and again would garner the highest score possible for our continuum. So with that, you have the projects in front of you that are being recommended to be included in our application. So much like our annual COC, we will submit the application with the projects, and then HUD will make the determination on award, and we'll hear back from HUD hopefully sometime before summer of 2025. We received a total of 5 projects. 2 were not selected. And the total award for each project is listed in the table there for you. And I will go ahead and pause for any questions.
Thank you, Emma. Is there any questions from the board members?
Have a comment?
Yes, Karen, please.
Thank you, Emma. Good job. Just a feedback, because I know that there's massive bang for the buck here. So I think I heard you say that these were projects that were further along that had secured funding. It would be really cool to see the total development amount, because I would imagine it's a very big amount when they're securing tax credits, other types of, gap financing and things like that. And I know that that had a big part of the decisions that were made, to be able, so I bet you
Absolutely.
it's like a big figure,
So
right?
I do have that amount because I was anticipating questions. So for example, like the Oakview Apartments, it's in excess of 25 million that they've already secured. For Valverde, it's over that 25 million for each project. So it is a significant amount of money that they've already secured.
Thank you.
How about the last one? How about the Kingdom Development? Do you have that one?
Linwood Rose, you know what? I don't have that figure here in my notes, but I can look it up for you.
Okay,
Yeah.
just curious if it was a big project because that's just a smaller number. Okay, any other board members have questions or comments? Dr. Chang?
I have some of my personal question. I apologize. Do you know if these projects are they blend and braid with No Place Like Home Fund specifically?
Some of them are. I think Marisol, are you on the call? Or Nicole?
Hi, good morning. This is Nicole Sanchez with HWS. Yes, the Via Verde project does have No Place Like Home funding committed to it.
I'm conflicted. Okay, thank you very much.
Very good. Any other board members have comments or questions? How about the public? Do we have any member of the public that would like to address this item? Okay, any other questions? There being none, Angelina.
When is the application actually due?
The 21st of November,
Okay, so right around the corner.
which is
Yeah.
why we needed this special meeting.
Right. Yeah, I just wanted to confirm that because it wasn't mentioned.
Oh, I'm
So,
sorry.
Yeah,
Yes.
I just wanted to add that into my notes. So thank you.
Thank you.
Thank you, Angelina. So we have a recommended motion to approve the 3 projects selected by the IRP for inclusion in the COC builds application as detailed in the table. Is there a maker of the motion? Angelina?
Second.
Second? Karen?
Yes.
Okay, any other questions? Okay, all those in favor say aye.
Aye.
Hi.
Any noes? There are no noes. How about any abstentions?
I'm abstaining.
Dr. Chang will abstain. It passes with 1 abstention. Okay, next we have the next item is announcements. Any member of the board have any announcements to make? Okay, how about staff? Do we have any announcements? Nobody? Nothing's going on? Okay, Daryl?
Karen, if you wanted to make the announcement for, was it November 21st?
Thank you.
There you go.
I appreciate it. Did you want to do it or in-person continuum of care? You do it.
I just know I'll be there for one. But also I think we're honoring a couple of nonprofits who kind of went above and beyond this year. And it's our first in-person meeting in a long time. But if you can share the details for it.
Yes, so the City of Corona is honored to host our in-person continuum of care meeting on November 20th in City Hall. It'll be the same time, 3 to 5 p.m. For those that can't make the meeting in person, we will have remote options like we always do. But as was mentioned, we're excited and kudos to Tanya and the team that launched the survey to get feedback about nonprofits that we should be recognizing for extraordinary work. And then also we'll be playing some fun games. I think Tanya and the team have some fun bingo games for us. And then we hope to just take some time to break bread together. We're sponsoring lunch from our city. Well, it's actually like an early dinner because it's 3 to 5. So, come hungry and, we hope that we could just spend time to talk to one another, to get to know one another a little bit more. In talking to Tanya and the team, we're trying to structure the agenda so that we can have more of that time together. We don't always get that. So it'll be good times for celebration, hugs, and, to get excited about the transformation we're going to continue to do in this county. So thank you.
Okay, is there any other announcements? Ben? Ben?
I was just thinking about the comment about how our vendors and organizations work together and how they can help each other out, leverage each other's resources, refer back and forth to ensure, good transition or continuum of care. And in thinking about my experience with rapid improvement events, and I know Riverside County recently went through a rapid improvement events, and they're so eye-opening because you think that things are working well and connections are being made, and then you realize, I didn't know that agency did this, and they did this, they do this also, and we could have been leveraging this resource. And so it's probably outside of the scope of this continuum of care, but maybe we can support an effort to look at how coordination happens amongst all the vendors, right? To see, how do we ensure that folks are getting the care that they need when they're transitioning from one level of care, if you will, or agency to another? Again, not to correct or mandate anything, but just to support what's going on in the community between the vendors. So just a thought.
Thank you, Ben. Any other member? Angelina?
Just a comment. I know the holidays are coming up, and as agencies, we always focus on our clients and making sure they have what they need for the holidays, from food, clothing, gift items, and things along those lines. I just want to put it out there that if there is a need from an agency, I would really recommend using the COC listserv to put it out there and say, hey, anybody have extra blankets or extra whatever? to see, because sometimes we do have an overabundance of donors that want to donate things to us that we can't accept, and we do try to refer them to other agencies. But if we know there's a need, then we can let the staff know, and the staff can say, hey, I know for a fact the Path of Life needs this, or I know for a fact that Galilee may need that, so that we can really not operate in silos, especially from the holidays, because all of our clients are our community. So if we can support each other's community, and I'll put it out there if we do have any extra items, because we usually do get stuff late after the holidays, right before the New Year's, that we use for throughout the year. But if there is a need, we're more than happy to be a resource for other agencies. And I think that is in the spirit of the holiday season. I think that's something we need to do and stop operating in that silo and in the effort of collaboration, because your client can be my client. And if I have an extra, why not share it with you? So I just want to put it out there.
Thank you,
and-
Angelina.
And along those lines,
And let me go
Oh.
ahead and ask Emma.
Thank
do you have any
you. Thank you.
questions?
Actually, I just want to not respond, but add to Angelina's comment that we've had agencies reach out to us when they have access. And so we'll send emails out to the COC and say, hey, if you guys want this, please let us know. And so we're happy to coordinate that. Recently, we had a huge donation of sweatshirts. And so many of the organizations were able to obtain some of those sweatshirts for their clients. So we're happy to do that.
Great. Did you get rid of all the?
I believe so. Yes.
Okay,
Yes.
good,
Yeah.
good.
And I have an announcement too, if it's okay.
Okay. Yes, you may.
Thank you.
Go ahead.
I just wanted to announce that one of our staff members, our HMIS lead, Gordon Kwong, has gotten a promotional opportunity within the county. And so he will be moving on from the COC and taking on a role at RCIT, the Riverside County Information Technology Department. And he is here. And I don't know if you wanted to say something, Gordon, but I don't want to put him on the spot, but I wanted to make sure that everyone was aware that we will be opening up a recruitment to fill his position. So in the interim, we do have staff members within the HMIS team that can step in to help support our agencies, but in case you email him and get a bounce back, I didn't want anybody to be surprised. We are so grateful for all of the work that Gordon has done with the team, and he has been such an integral part of the work that we're doing behind the scenes at the Continuum of Care supporting agencies. I know he's worked directly with each of your agencies, if not directly with you, but your staff members, to make sure that you're being supported.
Thank you. And Gordon, please, we'd like to hear from you. How are you doing today?
I'm doing well. I've never approached the bench. It's kind of intimidating. So I'll keep it short. I'm just want to say I'm super thankful and grateful to work for a department that's been so supportive on a professional and personal note. I know I'm leaving the system in good hands because our team has been so wonderful. Some of our OG members like Salam has been there for a long time with me, but we have some newcomers. Annabelle, Lizzie, and Natalis, came back to, help us out. So with their subject matter expertise, I'm really confident in the continued success and the processes and the features, that we've implemented. It's now been about 3 years since our system went live and, more time tested. And one thing I think I'll always remember is our community-based organizations. Like Emma said, I've had the privilege of working with some of you, individually, Path of Life, CityNet, City of Corona, Faith in Action, IEHP, and I won't be able to forget that how you guys always approach the reduction of homelessness in a human and client-focused aspect, whether it's trying to elevate their well-being or ensure that they're self-sufficient, or treating them with just respect and dignity. And in my new endeavor in RCIT, one thing that I can promise you is that homelessness and reducing that will always be a part of my goal. And I will never forget how no matter what enterprising solutions that I develop, with my department that at the end of the day, each data point is a human being in person. So it's, thank you.
Thank you,
Madam
Gordon.
Chair, can I say something, if I may, to
Yes,
Kim?
you may.
Gordon, I'm so proud of you and just the journey that you have been on. Your leadership has been stellar. And you and I recently talked about this great opportunity that you have. And I was moved to tears when you said you never forget the human being behind the data set. And I know that you're going to go and inspire all the rest of the folks in IT, because sometimes IT can get a little like technical geeky in a good way. We all need IT, but you're going to focus on those human beings. And I'm just excited to see what you're going to do to bring more transformation. Congratulations.
Thank you, Karen.
Any other board member have? I just want to say thank you for everything you've done. Thank you for being an ambassador for the work and wishing you success in your next adventure.
Thank you, Tanya and Emma, Heidi. Thank you so much.
Okay, so now we are going to revisit 5.2 and we are going to do the vote again. 5.1, I'm sorry. 5.1, we are going to revisit 5.1, which is a HAP funding recommendations for the Pathways to Home project. Okay, I'm going to open it up. Is there any questions from board members? Okay, any questions from the public? Okay, so I'm going to call for the vote for this item again. All those in favor of the recommended motion, which is to approve the HAP funding recommendations as submitted, all those in favor say yes. Aye.
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 Is there any noes? Is there any abstentions? Okay, so we have one abstention, two abstentions. Okay, glad we did it over again. Okay, so we have two abstentions and the rest are yeses. Thank you. Okay, so going back to the agenda, we have 7.0. Oh, one more announcement. Anise.
Late announcement, everybody. So starting over, we'll be hosting a legal clinic in February. We're trying to do these once a quarter and add them as necessary because we want to make sure we're reducing barriers for our justice impacted folks and the reentry community. And so this legal clinic will be for expungements. And individuals can register through our website, startingoverinc.org. So the next one that is scheduled, and it will be in Riverside at our office, is Saturday, February 8th. And we're also working to expand into the Coachella Valley, so we'll be offering expungement clinics there. But as we go along, if you have individuals who need that assistance, feel free to just reach out and hop on the website, because I think that's an important aspect of making sure that people have long-term success if they do have a criminal background, is to make sure that we're cleaning up things that we can when we can do it. And so I just wanted to announce that again, Saturday, February 8th, starting over Inc. 8:30.
8:30. Okay, thank you, everyone. And we're going to move on to the next item on the agenda, which is 7.0, call for agenda items for the next meeting. Board members, do you have any suggestions for a future agenda item? Okay, Carol?
You probably already have this on your mind, but I think for all of the agencies involved, if there could be some sort of information about upcoming and anticipated funding that you think might be coming down in any area, that would give us all kind of a head start, or give agencies a head start to think about it and to possibly consider it or rule it out. But that would be, I think, something that we could all use.
Absolutely. I'll just make a comment in response to that and share that every year, usually at around January or February, probably February this year because of our annual point in time count, we work with our HUD consultant, Joe Coletti, to do just that. So there will be a meeting. Perhaps we can make it hybrid, virtual, and in person, because I think it's always nice to have face-to-face interactions where we do just that. Carol will provide an overview of any funding streams that are going to be coming available.
Any other board members have any requests for agenda items? Okay, how about our team? Do you have any idea, any suggestions?
Just to note that during the last regular meeting, there were a lot of suggestions and items that we noted for our next regular meeting. Today was a special meeting, but just wanted to let everybody know that we are preparing for those. And while we will not meet for our regular scheduled meeting in December, we do plan to reconvene in February, and we'll have a full report out of all those items. So thank you.
Thank you. And we'll see at that time how the picture is starting to get formed for the national level as well, I guess. Okay, moving on to the next item. The next meeting is not going to happen in December, but we will be meeting according to our calendar, February 20th here, Banning. And then if there's no other questions or comments, I am going to adjourn the meeting at 9:56. Thank you, everyone. Have a great holiday season and Happy New Year.
Happy holidays. Thank you guys for all you do, and thank you for everybody who participated virtually.
Yeah, it was like too fast.